Hi everyone, welcome. This topic we're gonna talk about exercise and positioning. That's gonna pop up in the NCLEX RN exams. Let's get started. So feel free to download the templates under the on the descriptions. And for the purpose of this presentation is for the purpose of private study and research. I used Kaplan, UWorld, Registered Nurse, RN, NCSBN, and others resource for these presentations. Exercise. The NCLEX RNs, they will give you a condition and then say and then the in the select order apply. For example, they say patient has a DVT, and then in select order applied, you can they will say put patient on bed rest, and that's a yes answer. If they say make patient exercise, do range of motions, then that's not the right answer. So that's here, that's here. And then there's bed rest and immobilize. So immobilize applies such as post-hoc catheterizations. We need to keep the affect extremity immobilized for 4 to 6 hours to prevent bleeding, so to reduce bleeding, risk of bleeding. And then same as this one, long bone and pelvic fractures. We use splint to immobilize above and below fractures. Now, and then mobilize DVT. Now, DVT, they can get up to the bathroom. It does not increase the increase of PE, and it can reduce edema and leg pain. But I think that's pretty much it. We do not encourage them to do exercise, running, or walking around. So, but they can go to the toilet. Now, for this one, for this table, how I remember is, I just remember the immobilized stabilizations and mobilize. So what I remember is these two boxes. Okay, so these two boxes, once I remember, the rest is the bed rest for the NCLEX RN. If in the NCLEX RN this condition does not pop up, then it's belong to this one. So that's how I remember. That way it's easier. You don't have to remember all of this. All right, let's go next one. Exercise again. I have category like this. In your template, you should have something quite similar. So you got normal exercise. So normal exercise such as COPD after CAPD. And then gentle moderate exercise such as asthma. No contact sports such as bleeding conditions, patients on anticoagulants, antiplatelets. Now, no contact sports, I say no dodgeball, but it's okay for the following activity, because the patient, the question could say patients on anticoagulants and antiplatelets. Here are the following activities, which one they can do. So you can tick over that and then cross this one out. So that's why I put the activity example on the list here. And then here are no sports at all. So it's sort of similar to, well, not similar to bed rest, but as means no like really physical activities. And then split. Now exercise again, quite similar. Left side is type of exercise, and then here's the notes, that the description for it, and then here's the conditions that apply to the exercise. For example, range of motions to support ADLs, such as tennis elbow pain. You can encourage doing range of motions. And then I say not for patient with pacemaker. Okay, so if they would say patients got tennis elbow pain, what type of exercise you should encourage, etc. And then here, active range of motion versus passive range of motions and their conditions. Again, this one's more specific. It's the conditions and then the type of exercise. For this part, you just have to know. Just look at that, and then you sort of will get the similar understanding which activity might work, which activity might not work, depending on the conditions. Now, we're going to talk about position. The exam really like to use position. Patients NG feeding, what position you should put them in. You got foyer, semi-foyer, put it on the left, put on the right. Really confusing. So I have come up with a table that sort of break them all up to simplify it. So position left or right. So there's left side here, and then there's right side. Left side is all these condition. Right side is this one. Left is to avoid aspiration. Right, the empty GI content, as well as prevent aspirations. So what I do is for my next one, position supine or prone. Supine is the following condition, prone is the following conditions. With this one, how I remember is, I'm gonna get this one. Oh, yes. So how I remember is, rather than remember left and right, I'm just gonna remember the right part. And then once you remember all this, then left is easy, because if the question doesn't involve the following condition, then it must be on the left side. That's how I do the eliminations. For the supine, you can pick either of them. They look quite similar. So let's say I pick this one. I just remember this part, and then for this side, if the question didn't pop up that relate to the following, then it must be on this position. Okay, next one, positioning is the Fowlers. So low, semi, high, supine. For following conditions, what I do is I just remember the low, high, and supine. Oh, high and upright. And leave the semi-Fowlers and either semi-Fowler or high Fowlers, because if the question doesn't, the condition doesn't apply to the low Fowlers, high Fowler, or upright, it's gonna be in these two sections. It looks quite complicated, but once you do it this way, remember it this way, it's much easier. Again, position for the heart. I just remember these two, and then the rest is, the answer is this one. Oh, here I have put on the specific positioning that applied. Let's see what Trendelenburg, for example, really popular one. Here are the two conditions that we use for Trendelenburg. Positioning for this table, the left side is the disease or the conditions, and the right side is the position. Here, the positions, they can be multiple. Okay, for example, A, Immobilize, and CVC pick line. We use Trendelenburg, but then they're gonna say is the left side or right side. Then we put the. So sometimes the questions say patients. Let me see. Patients lumbar puncture. Then what position they need to be? Supine, fetal, lock roll. So these are the three. So they just not just in one position. They are in multiple positions. For this one, you just have to know and familiar with it. Just memorize, I guess. And that's all. Feel free to give me an email if you got any questions.